My name is Dr. Marcia Steingraber. This is Acupuncture and Wellness Center in Fort Lauderdale. Today, I'm going to demonstrate the N.A.D.A protocol, N.A.D.A, all capitalized. It's used for addiction and severe anxiety and PTSD. I'm also going to do some digestive work, as the stomach is the production center for serotonin. The stomach has to talk to the brain. These two centers, control centers, control mood, stabilization, anxiety, depression, how you kind of flow in the world, and also helps to increase dopamine in the brain as well. But if we only treat the brain when we're dealing with mental health, we aren't really serving the patient, because we have to make sure that the gut is in cahoots with the brain. Once we get the whole system balanced and talking to each other and going through the channels, then we can get somewhere with the patient, and we have much better results versus practitioners who only concentrate on neurology, which is fine. I'm just an overachiever and I like to do both. So I'm going to come around to the other side and we're going to begin. The N.A.D.A protocol starts with what we call auricular acupuncture, and there are 5 main points. And of course, there's battlefield. There's different ways of doing the N.A.D.A protocol. I'm doing it the way that I was taught in school, which is the old timey. Everything that I do, I like to do. And I probably don't need a tube to do this. It's just a habit. The old timey way of doing things. Now that's your baseline for the N.A.D.A protocol, and you want a patient to sit for 40 to 45 minutes with these needles in his or her ear. You can add on to this, or you can add to the other ear. Sometimes I like to do brain. And if the patient's having an issue with food, binging, purging, or anorexia, you can do the hunger center to try to balance out the hunger center. There are also points on the back of the ear as well that you can treat blood pressure. You know, it just depends on what's going on with the patient, but this is a basic. Brain has too much chi in it. It's not circulating. Patient has eating issues. You want to address that as well while you're here. Then I typically go over to the face and do yin tong, do 24. This time of year in Florida, I do a lot of Batong, which is sinus treatment as well. Of course, that's not part of an addiction protocol. So this is Batong, and Batong is something that I always do bilateral. N.A.D.A is something that you do unilateral. Whether a patient needs it or not, I defer to their preferences. The feedback that I get from patients, I like to do Sisin Kong and then go along the ridge and end with GB8, which is an amazing point for vertigo, dizziness, just feeling unstable in the body, the head feeling unstable. It helps with hangover if they're still coming off of drugs and alcohol. Do not take on severe addiction cases by yourself in your clinic. This is after a withdrawal protocol done by a doctor. This is a basic treatment protocol for digestive issues, serotonin production. Also, if a patient is a long-term drug and alcohol user, you may want to have them start taking apple cider vinegar tablets and a probiotic, because we have to reestablish the first production of serotonin. 90% of your serotonin is produced in your gut. When you have decimated your gut with drugs and alcohol, it needs to be replenished. You want to clear fire, stomach fire, any type of heat in the body. Addiction causes a tremendous amount of heat. These are the yin channels of the body, the leg yin going up to help with serotonin production. And we just want to reestablish good, healthy blood production. Again, we're trying to clear damage and make the patient comfortable in their own skin. Always do kidney 9. It doesn't matter what you were taught in school. It's a she cleft of the kidney channel, and it is tremendous for anxiety, and you always just want to do it. Stomach 40, always do it. People who have addiction issues have phlegm. Stomach 36, bank up the good chi, have their body start working for itself. GB 34, clear heat. Spleen 5, worry point. Spleen 4, digestion. Kidney 6, bank up yin. Liver 2, clear fire, clear liver fire. Stomach 44, clear stomach fire. You have to clear the fire point. It doesn't matter how you get there. You have to start clearing heat from the body or the patient won't be comfortable in their skin. It's like having a teapot on a stove for too long. If there's too much heat, it's going to whistle. You're just going to have the brain whistling and agitating the body.